building accountable and open, inclusive health systems around the world. I'm so pleased that you've been able to join us today, wherever you are in the world. Good morning, good afternoon, and good evening. I'm the CEO of Results for Development, and our mission is to support change agents who are building strong systems for healthy and educated people around the world. And for many years, we've been helping countries build strong, sustainable institutions with a focus on ensuring that governments are accountable to their people. And of course, this has been a huge focus over the last several years through this pandemic. And that's why I'm so excited about this discussion we're going to have today. I feel like there are so many lessons to be learned from the past several years about how we can better integrate transparency, accountability, and participation in order to create stronger health systems for future pandemic preparedness and response. And this conversation is really crucial at this moment. There's so much attention and funding flowing into health systems around the world. It's a crucial window of opportunity, both to ensure that those funds are really well spent, but also to make sure that there's better trust between communities and governments around the world. So there's a lot to talk about. We have a fantastic panel today. We are bringing together health systems experts and accountability and governance experts. So much to learn from one another. So I'm really happy to turn it over to our moderator for today, who is Michael Jarvis. He's the Executive Director of the Transparency and Accountability Initiative, and he's going to welcome our full panel. Over to you, Michael.
Thanks so much, Gina, and it's a pleasure to be with everyone today. And
they are like spending a lot of time.
I just ask those to mute themselves if they're not speaking correctly. Thank you. So, as Gina mentioned, I had the Secretariat of the Transparency Accountability Initiative, TAI. That's a collaborative of funders in the good governance space, primarily US-based foundations, Chandler, Ford, Hewlett, Luminate, MacArthur, OSF, SCOL, and we also have the UK Development Agency as an associate member. And we come across this topic because we were hearing from many member grantee partners about work they were doing in response to the pandemic, that were part of a bigger picture health response. And that led us to try and think about how we might document those and how that might inform future pandemic responses, an important role that civil society can play in that. So we've been delighted to partner with R4D on this event. We have a very illustrious panel, as Gina mentioned, and we'll get to them in a moment. But it's also the occasion to formally launch this new report that tries to share these documented lessons learned. And I'm going to pass to Courtney Tolmie, who's been sort of the lead researcher and author of pulling that together. And she's going to kick us off by asking a few questions to orientate ourselves. I'm sure others will be joining the session as we go, but this is a chance for those of you here to sort of get a bit of the lay of the land. So without further ado, Courtney, I'm going to pass to you. Thanks.
Great. Thank you, Michael. Thank you, Gina. And thank you everyone so much for joining us today. We're really excited to have this discussion, hopefully share some new ideas, some strategies, and some opportunities for collaboration across these communities. So as Michael said, we wanted to start off with a couple of questions for all of our participants. So we'll go through these pretty quickly, but if you take a look at the top of your screen, hopefully you see instructions. We'll put them in the chat as well for a Menti poll. So if everyone, hopefully at this point in the pandemic, everyone's familiar with Menti. I know we all use it a lot, but if everyone could go to menti.com and plug in that 8-digit code up at the top and in the chat. We have just a couple of questions that we'd love to kind of crowdsource from our participants here. So we'll give people just a minute to answer this one and see if some of the responses come up. Basically, what we want to hear from you is in 3 to 5 words, how would you describe COVID pandemic governance in the place or places where you work? So quick descriptions, phrases that you would say describe COVID pandemic governance. We'll give folks just a minute to respond. All right, disorganized. We're starting on a negative note. Uneven. All right. give people a few more minutes. Paternalistic. Oh, these are great, great terms. All right. I love, so the innovative here. I think, you know, a lot of what we talk about, and certainly some of what we saw with our research, was breakdowns, but we also saw some really positive bright spots as well. So great to see some of those coming through. All right. Great. Okay, so let me move on to the next slide. You'll have a few other opportunities to respond here. All right, so the next question is a little bit more quantitative. So how would you rate the level of transparency, inclusive participation, and accountability in the COVID response in the place or places where you work? So kind of have a 0 to 10 scale here, 0 being way too low, there was not enough of it, and 10 being people did great on these topics. Okay. Few responses here, kind of ending up in the middle, well, the lower end. All right, and interesting to see, I think in TPA, we do sometimes see this transparency is okay, but then when we start moving down to participation and accountability, the situation doesn't look quite as good. All right, we'll give just another 10 seconds or so if anyone else wants to join in on this one, but I think that's a helpful picture to see from people who have joined. And anyone who just joined, we are starting with a couple of questions for participants. Hopefully you will see instructions in the chat to be able to join. But maybe moving on to the last question. So we wanted to end on a positive note, which again is a lot of what we're going to talk about today, actually, which is what is one bright spot that you observed in pandemic governance in the place or places where you work? And you can provide just a short phrase, a couple words. We'll have a chance during the breakout sessions later to explore these further. But just to give us a little bit of a hint into what you saw. Trust, great. Glad to see there was some trust out there. Vaccine production, that was a huge one, agree. Multi-sectoral collaboration, great. All right, and we'll give just about 30 more seconds. We want to collect a few more of these before moving on. Wonderful. So a lot around coordination, collaboration, and also kind of surfacing some issues, some problems that may have come up, citizen voices raised. So this is great. And like I said, we are hopefully going to have some time. We'll definitely have some time at the end of the session to explore all these more. We'll also have the panel that will maybe be able to respond to some of these that have come through. But I am going to close out the Menti for now, and maybe we'll move on to this next part where, as Michael said, you know, we wanted to use this opportunity to formally launch this report that I've had the pleasure of working with the Transparency and Accountability Initiative on for the last several months. To share some of the results and the motivation, and then to pretty quickly turn it over to our esteemed panel of experts that sit on both the governance and health sides to really kind of engage further in this discussion. Okay, so we wanted to start with a little bit of information about what motivated this report and this research. And Michael has shared a little bit of this, but just to give a bit more detail, you know, I think probably like everyone on the call, I and partners that I worked with, you know, spent probably the first 12 to 18 months of the pandemic feeling like, okay, how do we respond? How do we adapt our work, whether it be from the transparency and accountability space or the health space? What do we need to do now? And I think as we started kind of moving to this next phase of the pandemic, as vaccines were coming out and we started to see hopefully a little bit of a light at the end of the tunnel, I think a lot of us really turned to reflecting. And as we were doing this reflection, a number of key points came up that really motivated us to do this research and these discussions with partners that were working in the space. So the first thing that really motivated this work was this idea, and I think the Menti poll suggests that a lot of us agree with this, that governance failures can be identified in all elements of the pandemic response. So, whether it be global governance, information sharing, corruption around vaccines, supply chain issues, everything from the hyper local level up to the global level, there were governance issues that, served as a root cause for some of the bigger problems we saw with the pandemic response. And equally importantly, to recognize this is actually part of a vicious cycle. So a new report that came out from Southern Voice and UNDP just about a month ago looked at actually the opposite direction of this relationship. We know that governance problems hurt the pandemic response, but this report from Southern Voice and UNDP also showed strong evidence that the pandemic actually hurt governance as well. So this is this vicious cycle that we wanted to make sure to look into more. The second point that really motivated this work was a little bit more from the positive side. So in all of these governance breakdowns and problems that we observed during the pandemic, we also saw a number of bright spots. And in particular, when it came to root causes that were related to transparency, participation, and accountability, or a lack thereof, we knew that there were a lot of examples and cases at both a small scale and a large scale of TPA strategies that really helped to either mitigate these breakdowns or at least lessen the severity of them. But these were really scattered across the space. We knew, a lot of us knew examples, we knew partners that were working on exciting things, but we didn't find them kind of cohesively placed anywhere. And so one of the things we wanted to do with this research was really to look at them in a little bit more of a framework to understand what we can learn from the bigger picture. The final point that really motivated this work for us was something that I think a lot of us heard in certainly the first 12 to 18 months of the pandemic, which is this kind of excuse that because people needed to act so quickly to respond to this global health emergency, that accountability had to take a back seat. Well, as we started doing our research and our interviews and talking to people in both the health communities and the TPA communities, what became very clear is that while the speed of the need for speed in this response required adaptation, it did not mean that we needed to drop accountability. We didn't need to drop transparency. And so we wanted to look quite a bit more into the strategies that different partners used to try to ensure that accountability was happening side by side with the rapid response that was needed for the pandemic. So in terms of the report itself, we wanted to ensure that this was not just a response that was coming from the TPA community directed to the health community. We recognize that, the real value and potential of building governance, transparency, and accountability strategies into health responses is by working collaboratively and not just creating a whole new framework. So what we did for this research is we actually started with an existing framework, an existing set of recommendations for future pandemic preparedness and response. We used the G20 high-level independent panel proposal, which is called A Global Deal for Our Pandemic Age. And this proposal identified 5 key gaps that really span across the health sector that we need to fill, or this group said we need to fill for, to ensure that our next pandemic response and preparedness is better. Using those gaps as kind of a framework, we undertook an academic and gray literature search, starting with the governance breakdowns. Within each of these 5 gaps, what was breaking down from a governance standpoint that might need some sort of TPA-related solution? We then undertook a large set of interviews and a parallel literature review to identify those TPA strategies. This included TPA strategies that were employed during the pandemic, as well as strategies that had actually started way before COVID began, but that we saw adapted and used in pandemic response in a really helpful way. And then finally, we set forth a series of recommendations for both immediate and long-term integration of TPA and global health solutions. I want to be really clear. None of these are out-of-the-box solutions. These are not things that we're just going to pick up and easily implement. But they are solutions, they're approaches that are evidence-informed. In a lot of cases, they've been proven to work at either a small scale or in some cases at quite a large scale. And if we work on them now, there's a potential that come the next global health emergency, we have a better response and a better ability to respond in place. So what I want to do is take just about the next probably 5 or 7 minutes, not to focus on the breakdowns. We do recommend you read the report. There's a lot of really, I think, helpful information in the report about the breakdowns, both from the health and governance communities. But we instead wanted to focus our kind of discussion today on the positive side of things. What are some of these TPA strategies that we've seen that we think are worth further exploration as we think about preparation for the next health emergency? So I'm just going to point out a few examples. This is really just a handful of what is in the report, but just to pull out a few things to motivate, hopefully, the rest of our discussion. So starting with the gap of needing to strengthen resilient health systems at the national and subnational level. So we know that health systems are made up of a lot of different components, and not all of those components are necessarily going to be affected by governance solutions, but we know a number of them are. So just 2 examples to talk about. One comes from an organization called the International Budget Partnership. I think we may have some representatives from IBP on the call today. IBP works on a wide range of different issues in budget transparency. And actually their research from several years ago has really motivated a lot of collaboration between the transparency and health communities. Research that they did found really strong evidence that fiscal openness and transparency is associated not only with increased trust and participation, but actually also with improved health outcomes. So this is a part of resilient health systems that we know can really help ensure better outcomes. IBP does a lot of work supporting civil society and activists. And just before the pandemic, they started a program called SPARK, which was supporting these groups and individuals in 7 different countries. Once the pandemic hit, they had to really kind of reevaluate and adapt their strategy. But because of the foundation that they had set forth, working with civil society organizations and activists to work directly with government to ensure that budgets were more open and more responsive to the needs of citizens, they saw a lot of improvements in the countries where they were working, specifically in terms of COVID response. That includes policies that were strengthened to support marginalized populations in Senegal, in particular people living with disabilities, as well as support to local government or district level government officials, municipality government officials in South Africa to use data of what was not working at the community level in terms of health and other services to actually improve access to those services. So this is just one example at the local level. You know, that looks at kind of the supply side. If we're looking at health systems, looking at the demand side, we also see some really innovative TPA solutions. So one example from Accountability Lab, which really takes a focus on not naming and shaming poor performing government officials, but instead really celebrating both government officials and other influencers that are really acting well and supporting communities. Accountability Lab was able to take a model that they've worked on for many, many years, again, adapt it to a COVID, a pandemic setting, and work with some of their integrity icons, these influencers, to really spread positive and accurate health information to really combat what we saw in terms of a decrease in demand for health services, due to misinformation, disinformation, and other governance problems that arose during the pandemic. So those are just a few examples related to resilient health systems. Turning to another gap, which is around the supply of medical countermeasures and tools, I would say one of the biggest stories that I think a lot of us heard in terms of the negative side of the pandemic was supply chains breaking down, and in particular, corruption, nepotism, lack of supplies related to everything from personal protective equipment to vaccines. This was another place where a lot of longstanding TPA practices and policies really helped to sort of smooth the path in terms of ensuring that pandemic response worked better or was corrected when it wasn't working well. So 2 examples here, one from the Open Contracting Partnership, and you'll get to hear from a colleague from OCP during the panel today, Zoya, who can speak more about this. But, you know, for a lot of countries that had done a lot of the work before the pandemic to ensure that there were open procurement and open contracting policies in place, the answer was a little bit easier. They were able to look towards those policies, and when they started to see breakdowns in contracts, in the way that they were delivered, in the way that they were being awarded, they could use those existing policies, these transparent and open procurement policies, to really improve what was happening and respond quickly. And this was the case from the Public Procurement Office in Lithuania. There's a number of other cases where we saw this. On the flip side, in some places, there needed to be more of a response, in particular from civil society and journalists, where maybe some of those open procurement and open supply policies really were not in place. So again, one example is from organizations in South Africa, the Public Service Accountability Monitor and Open Up. Both of these organizations work together on civic tech solutions to be able to monitor breakdowns in spending and procurement. And these groups were able to respond really quickly to problems that they saw, both in terms of corruption, but also just data availability, and create this new site that is still available today, Keep the Receipts, where they uploaded data about procurement, and they were able to kind of provide this information to activists to push back on areas where the data wasn't making sense, where there was evidence of corruption. So moving to the final gap and just a few additional examples. So a final gap we want to talk about is around the financing of pandemic preparedness and response. We know that COVID is really this unique case where, you know, countries of all income levels, all resources around the world, we're dealing with this need to respond to this emergency at the same time. And this created opportunities to support across countries, but also potential areas for breakdowns. And we saw this in financing from high income countries and middle income countries as well. The TPA solutions we see here also range from more country level solutions to global solutions. Two examples to point out. One comes from the COVID Transparency and Accountability Project, which worked with many different countries. This particular example is from Nigeria, where CSO partners in Nigeria developed this COVID fund tracker. The idea here was to have a place where they could pull in data, not just about what the government was committing to, but also where there were international flows of data or flows of funds and flows of resources, so they could see where those problems remained. Taking it up a level to the international scale, you know, we see that there's lots of really great guidance out there, in particular from the Open Government Partnership and Publish What You Pay. Sorry, that should be Publish What You Pay, that really has great guidance and very clear roadmaps for how to put rules and policies in place for international organizations, whether they be state level or private foundations, corporate foundations, whatever it might be, so that when they are putting in funding in response to something like the COVID pandemic, that we have the policies in place to make sure that those flows are transparent, and that there's the ability for citizens and civil society to participate in the monitoring and decisions about where those go. So just to wrap up before handing it over to Michael and the panel, you know, we want to share just a few points about how we hope that these lessons will be useful and can potentially be used by both the health and TPA communities. First of all, as I've mentioned, what we've shared just in the last 20 minutes or so is really just the tip of the iceberg. There are so many examples and cases and stories and evidence in this report that we really do recommend that everyone checks this out, takes a look at kind of the broad range of bright spots, as well as kind of existing gaps that need to be filled. Second, you know, we wanted to keep this report fairly short and sweet and digestible. What that means is that a lot of the partners and organizations that are highlighted in them are really just highlighted at a very top line level. There is so much more that all of these organizations have done, including developing really clear guidance and roadmaps on how TPA can be implemented in the future. So if you are interested in any of these topics, we recommend starting with the report, but definitely doing a deeper dive into the work and the different resources that we link to in the report, because there really is so much more there. Finally, we really want to emphasize the need to look forward. This report, by its nature, started out as very backward looking. We wanted to understand what happened during the pandemic and what we could learn from that. But the whole purpose of this was really to pull out strategies and lessons that could be used when we're thinking about the future. You know, we know that there will be global health emergencies that happen down the road. We know that there's a lot of discussions happening right now within both the health communities and the TPA communities about that. We know that these are two communities that before the pandemic worked very, very well together and closely together. But we also know that when an emergency hits, it's very easy for sectors and groups to kind of splinter off and work on their own areas. And so our hope is that the recommendations in this report and some of the ideas really serve as inspiration and motivation for continued collaboration, and in particular things that organizations can do to set up now. Because one of the things that we saw consistently across all of these gaps and all of these solutions is that they worked better when there was the TPA foundation in place, with countries and places where there was already strong policies, strong civil society. They were able to adapt more quickly than needing to start from scratch. So our hope is that this really motivates some continued collaboration, discussion, and work together on these issues. So with that, I will turn it over to Michael to kick things off with our panel.
Thank you so much, Courtney. Lots to dig into there, but we're going to use the next 30 minutes to tap the collective brain power of the illustrious panel. I'm not going to do introductions, and I could speak for many minutes on each of the bios of the panelists. So I hope they'll forgive me for allowing people to do their own checks on that offline, but get into the conversation. But suffice to say, we have perspectives from working with government, from the research side, working with global institutions and with funders. So I say we kick it off. And Wangari, maybe I could start with you from a country level of perspective. You've been advising the Kenyan government on its response during the pandemic. And I wanted to ask, are the ways that you've observed how civil society participation played out during COVID-19? Were there positive aspects? Maybe were there some areas that made it more difficult for the government to be quick and nimble and getting the right responses in? I'm keen to hear how it seemed from the on the ground perspective.
Thanks, Michael, and thank you for not introducing us. My introduction would have been the shortest, and I'd have felt challenged. But thanks, the R4D team for inviting me, and for the great work that's been done here. Michael, your question is a difficult one. It's one of those ones where I'm damned if I do and I'm damned if I don't. But I think it's important to set just a very quick context before I respond to it. I wanted to remind us that at the beginning of this pandemic, accountability does not look like the usual way we expect accountability through the normal governance structures, through the normal procurement systems that we are used to. Must remind us that probably the participation, even in the usual governance structures, by the ordinary citizen is not that high unless it's political season like it is now. So that's one. And then, of course, number two, which is extremely important, is the magnitude of disinformation that was happening at the time. Kenya recorded her first case in March 2020. This was the time Italy was Armageddon, and I hope the diplomats will allow us to use that word. And so governance in that space, or accountability or transparency, looks like Kenyans looking at videos coming from China, coming from Italy, then quickly Spain, before it spread towards the West, and wondering why does our situation look so different, yet we are being told to prepare for an apocalypse. Must also remind us that to date, over 90% of cases recorded in Kenya are still asymptomatic, which means, at least for the beginning of the pandemic, when we were doing kind of random mass testing. Now testing is only compulsory if you have symptoms or if you're traveling abroad. It becomes very difficult to then convince the general populace that this is out there, because what the immediate becomes is to compare what we have versus what we're seeing in the world. And of course, the government response would have been take all precautions necessary, especially because of what we were seeing in the countries that I've just mentioned. Then following quickly to the UK and then the US, and unfortunately, many millions of lives lost. And so you shut down everything, including people's businesses, 80% of our population working in the informal sector. And almost anything you do in the context in which, or at least in the experience that majority of Kenyans were having, it almost becomes unbelievable. That's point number one. So I think one of the things that civil society was very good at was to ensure that what is out there is visible. So what is out there is visible, but you must remember that what is out there is different from what we are seeing at home, number one. Number two, there was the height of probably disinformation, not just because of the pandemic, but also other political factors. There was a lot of interest, though, towards somewhere, I would say August, September 2020, in not only just how the financing for the pandemic is going locally from government resources, but also from private sector. Private sector set up a COVID-19 fund, and it was very key. The general populace was very keen to understand where this money is being spent, how it's being spent, and on what particular items. It was kind of one of those cat and mouse games, because in March you order for a pair of gloves, it cost 10 times what it cost in August, but you placed orders, as much as you could get because of the global supply chain issues that we had at that time. And so looking back now, just as the presenter mentioned, that this kind of a retrospective study, when you look back now, a lot of things become difficult to explain, that you must remember this is in the context of that time, you must remember this is in the context of that time, and the required speed and agility and lack of visibility as well for the decision makers. So I would say the greatest win, I think, was the push to allow visibility of what is happening, because we knew that was not everywhere. Over to you, Michael.
Thank you so much, Wangari. And I think a really helpful reminder of how we tend to just throw out COVID-19 and talk about it as if it's a common experience, but actually there was a lot of variety in how it played out in practice, and therefore the responses that were fit for purpose. You mentioned procurement, which is a good lead into turning to Zoya. Courtney mentioned some of the examples that were documented where speed and urgency of getting new supplies, PPE, even vaccines, etc., didn't necessarily have to be at the expense of good process and accountability. And I was wondering if you could just talk to that a little bit, like what you found worked in that regard.
Thank you, Michael. Yeah, sure. So I would say that the situation is quite opposite, because as we see, if we have the well-structured, open, high quality of data at place, our states, our governments could actually move faster, because they are not blind about the prices existing on the market. They are not blind about the suppliers who exist on the market. They can compare the situations, and they can insert different interesting, like tech tools, dashboards. They need to check the COVID contracts and to disclose the information about the announcement, about the quantity of the demands, and they could even and all in all, it could mitigate the risks of corruptions and the risks of misuse of the funding, or the risks of being fooled by the suppliers, by the companies who actually are so-called multi-purpose companies, or companies who have been just established before the winning of the contract. And yeah, you could be lucky enough, and these guys managed to deliver the supplies, but the risk of being like getting without resources, and what is even more important, the risk for the patients of being without their so essential medicines or goods, whatever is too crucial to take this risk. And as Courtney mentioned about the Lithuania, for instance, so the situation was the following. After some months of the COVID, the civil society organization Watchdog decided to actually analyze how the government dealt with the procurement. And for this purpose, they opened the data. So there's a separate dashboard tracking all the COVID-19 procurements was established, and the information was placed there using the open contracting data standards. So meaning that on the dashboard, you can see who procured, what procured, for what price procured. And you can track if there were some risky behavior, if your state officials had some suspicious connections with the companies that actually won the tender. And also to mention that there are a lot of tools that were practiced during the COVID, and I believe that they are extremely beneficial. For instance, indexing the suppliers. Yes, so you know whether they have experience, whether they have good reputation, whether they are specialized in the procurement of specific actually supplies. Also, the crucial element here is the exact moment when you disclose the information about tender. Because, for instance, in Ukraine, we had a great example that the government, the officials, they disclose not only the information about the contract, so like price, amount, item, but they also published the full contract with all the annexes. In addition, the special business intelligence tool was created to analyze all of this information. This means that actually you are, with the help of civil society, with the help of journalists, you have the opportunity to use the real-time data and to navigate your supply, to intervene whether you see any risk, or even to react, or at least not to sign the contract later with the risky supplier. And I would just emphasize that the main goal for us is not just to collect the information. Yeah, the main goal is to analyze it and to use it for transformation of the procurement and supply system. That was the case for the Lithuania, or the main impact after the COVID, because after analyzing the information, the data from the COVID dashboard, they actually moved ahead for the open contracting procurement reforms, and it is the main vital issue here. Thanks, Michael.
Oh. Thanks, Nora. It's lovely to hear that they're actually learning from the process and applying that into, adaptations to the system going forward. But you mentioned that countries that have put in place certain sort of systemic changes ahead of time, like adopting the open contracting data standard, put them in good stead here. And I wonder, Nathan, as you've been looking from the R4D experience, looking at multiple countries, and how much you felt, those that had good governance in place were put in a better spot or not in practice. And did you experience any ways in which governance was a problem in trying to help countries navigate the pandemic?
Great, thank you, Michael, and good morning, good afternoon, good evening, everyone. I'm Nathan Blanchett. I'm a Senior Program Director at Results for Development. And let me just say right off, speaking of transparency, that everything I'm going to say today is my attempt to represent what I've learned from colleagues in the field and partners in other governments. I'm going to try to be faithful to what I've learned from them, but they really are the experts on this. And Michael, responding to your question, it's a great question, and I was hoping to focus on the sort of governance element of this. I think, I'm a health systems person, a public health and health systems background. And when I think about pandemic response, one of the first things I think about is that this goes beyond the health system, actually. But first of all, within the health system, it touches on multiple parts. There's no single government agency that would have the clear responsibility or capability to respond to everything. And it also clearly goes beyond the health system. So it is at least a complicated endeavor to respond to something like this. And it's probably a complex one, meaning there's feedback loops and things that need to be adapted to as you go on. So it's a hard governance challenge. And I think that raises the question of how to coordinate that. This is not something a business as usual. There's multiple pieces of systems that need to be brought together in a way that they are not normally brought together or designed to bring together. And I would say one of the places that we have been able to support the most, our team, has been Ghana. And Ghana showed really some great strengths, particularly in the first early several months responding to the pandemic, that really were governance strengths. For those of you that know Ghana, you'll know that they start with a very strong context. This is a strong democracy, vibrant media, competitive elections. There's a good amount of transparency, accountability, participation in the system, very strong health system with robust institutions. But again, the pandemic requires a different approach and different connections. They very early on established the president, established a presidential level interministerial task force to coordinate a multi-sectoral response. So right there, I think there was some history and context of that in Ghana and other West African countries fairly recently in terms of the response to the Ebola epidemics. And a fairly rich tradition of interministerial cooperation in Ghana. So they got that sort of starting piece, I think, very right. That political leadership was there. It was frequently communicated by the president himself. And then they set up the technical support to that, again, across multiple areas. There, all of the Ministry of Health and World Health Organization actually co-chaired a technical committee. They drew on technical experts from multiple ministries, and they set up a coordinating secretariat that R4D had the privilege of helping support. And that was chaired by a former Deputy Director General of the World Health Organization, Dr. Abiy. That secretariat was able to pull in technical advisors on various topics, health and non-health, to support the regular committees that were set up with technical advisors from various ministries, and they were able to really provide a good amount of technical advice and coordination that was able to tap into. And this is the second most important piece: you need coordination, but you also need to not recreate the wheel. They leveraged all of Ghana's existing institutions and processes, both in the health system and in broader governance system. Ghana has a fair amount of devolution of power to the district level. They were able to tap into existing processes at the national, at the regional, and at that district level to be able to tailor some of the responses. One nice example of this is provision of food assistance in particular epicenters that had to go through lockdowns. So they did not lock down everywhere, but they did have lockdowns in particular places where they were seeing high rates of transmission. And because of the cross-sectoral and the local participation that they were able to tap into, they were able to target social assistance like that in their response. There's lots more to say about Ghana, but maybe I'll pause there just to say that on that first challenge of showing high-level leadership, getting coordination of multiple pieces of multiple systems, and having participation both from national level down to sort of district level participation, they got a really nice setup. And I think there's hope that that will, they can even build on that for future pandemic responses and other responses as well.
No, thank you, Nathan. That's a really useful reminder, a slightly more holistic view of what governance is. And it really is sort of this issue of how well agencies cooperate, how do you sort of have decision-making structures, how do you build on existing platforms and initiatives and not sort of create parallel things that further exacerbate the silos. So that's great to hear that example. Mariam, I think there's probably been a little more criticism of what's played out at the global level and a lot of reflection about the structures of global governance in the health security sector coming out of COVID-19 and thinking about what next needs to be built for future pandemics. And I wonder what your reflection is on ways we might help ensure that global health bodies are accountable and effective, and how we might boost the global level responses. That's sort of one section of the report.
Thank you, Michael. And I want to start by thanking you for starting asking questions about lessons from countries, because after all, the pandemic response is really dependent on what happened in countries and subnationally. That's where the rubber hits the road. But now you're asking the multi-million-dollar question, which is global governance. When the independent panel for pandemic preparedness was trying to tackle the question that you raised, they said, do you want transformation or do you want to tinker? So do we want transformational change or just tinker at the margin? And clearly the kind of issues we are talking about here is about transformational change. If we want to boost governance and hold agencies accountable, it really is about the global architecture and how we work. And as you said, Michael, right now we are not seeing an increased efficiency or a simpler global landscape. Right now in front of our eyes, what we are actually witnessing is a more complex landscape. We have seen new bodies coming in place. We have the response to the independent panel, which asked for a global health threat council. They wanted an independent panel, and the reason for that is what others have said here. The problem is multi-sectoral, it involves multiple agencies, and you have to have a body that has the mandate and the authority, and that's legitimate, that is inclusive, to be able to actually keep a watch on transparency, accountability. So in response to this call for a new body, we have WHO that's put on the table, a Global Health Threats Council. You have the UN Secretary General suggesting a UN emergency platform. You have GERM, the Global Epidemic Response and Mobilization Agency. You have already since before the Global Pandemic Monitoring Board, and you have what now is also on the table, a FIF, a Financial Intermediate Fund, which is very similar to how the Global Fund is set up. It's also a so-called FIF. So here we are talking about improving, strengthening transparency, participation and accountability in a landscape that's complex. So one could say, well, should we just tinker on the margins? But we don't need to tinker. As this report has shown us, there are some really concrete suggestions and recommendations, and I will only highlight 3 of those that's coming out of the report, and I think our collective experience. First of all, it is an agreement on metrics, data sharing. How can we hold global or national level entities accountable if we don't have a common understanding, some standard metrics by which we, measure progress and understand what's going on and can tell whether our strategy is working or not? So we really need data and open access and sharing of that. That's so basic, but we really need to strengthen that surveillance system, not just within countries, but globally. Secondly, I would say, in an environment with increasingly alternative facts and really lack of even technical consensus, I think many of us have seen lack of that at country level. Then it becomes even more important what you talk about in this report, which is scientific literacy. Civil society, media, all need to know where to go for information, be able to question, not necessarily have the answers, but question. I have to tell you from my country experience, what I have missed in our weekly media events were the tough questions. I wanted to hear, okay, if you think you shouldn't wear face mask, then what's the source of that information? So it's not just about data and facts, but it's about the source of data and facts. And thirdly, I would say clearly, when we have new entities now, then we have to ensure that the community, transparency communities, CSOs are an integral part of that, not just, annual consultations that one has with civil society, but that they are part of new boards, part of the fifth, funding mechanism, and can be part of the decision making as well. So I think those are, for me, Michael, maybe the most important lessons globally, because I don't think we will see rapid reform measures, but the things that global entities can do to facilitate action in countries.
Oh, thank you, Mariam. That's super helpful, and it's going to be an interesting space to watch with all those sort of competing and potential entities there and how they relate to each other. Which leads me, Dana, last but not least, on a funder perspective, working in philanthropy, I see silos between different themes, and it can be a challenge to break down those, and that extends to communities and practitioners as well. And as someone who's funded both health systems work and transparency, participation, accountability work, I wondered if you had any thoughts on how we avoid some of those silos, including on the funder side, and in any ways that we might strengthen collaboration.
Yeah, thanks, Michael, and thanks to the panel and give me the opportunity to speak. I know we're behind schedule, so I'll keep this pretty short. But yeah, I spent most of my life in the health sector, and then I guess the last 3 years in governance and funding some governance work and TPA work. And it just seems that both sectors are siloed, as you said, Michael, and both could learn from each other. I think the governance field could learn from the health sector about measurements, about a focus on results and outcomes, about complex adaptive systems thinking. And similarly, the TPA and governance field is much more comfortable talking about power and politics and elite capture, whereas health is dominated by, I guess, technocrats, clinicians, epidemiologists. And so it's this issue of power and elite capture that's central to the new Hewlett strategy on inclusive governance, but also I think is central to effective government, central to accountable government, central to pandemic preparedness. And this issue of elite capture, which effectively is when elites capture power for their own interest, private interest rather than public interest, which I want to talk about. And so we see this in health, this issue of elite capture. When we talk about health expenditure, when we talk about universal health coverage schemes, that health expenditure, for example, is largely captured by tertiary care, by urban elites for hospitals. And primary care is really starved for resources. And I say this because primary care is fundamental to pandemic preparedness, primary care and community-based care. It's a real building block because it pays for surveillance, it pays for contact tracing, it pays for early treatment. Primary care pays for information and disinformation at the front lines, or information at the front lines and in communities, for vaccines. So that's all pandemic preparedness. And yet we find most monies goes to tertiary care and to urban elites and their care. I worked with Mariam and Gina, in fact, for some time, and we found, WHO did a paper a couple years ago, which found that in lower middle income countries that have data, that only about $1 out of $5 is spent on primary care. Most health money people are surprised at this, is spent on tertiary care for elites and for curative care. And so this issue of power and elite capture is also, I think, manifested in universal health coverage schemes, where they typically start with the formal sector, with the rich, with curative care, with hospital care, and it takes forever, and sometimes they never get down to primary care, to prevention, to promotion, to the issues that lead to better pandemic preparedness. And so I say all this because elite capture, in fact, gets worse or can get worse during moments of crisis, during moments of pandemics. And so I think the health field can learn from the TPA field about how to work with movements, how to work with civil society actors to be a countervailing force, how to increase budget transparency on how much is paid, but also what is paid for in health budgets. Because if you wait for the next pandemic, we're still going to have elite capture. It's still going to be largely tertiary care. The rich are going to be just fine, as they were largely in this pandemic. And it's rural areas, it's slums, it's folks who count on primary care and prevention and promotion and surveillance systems outside of urban centers, which I think are going to suffer again. So that would be what I think health could learn from TPA and the government sector. Thanks, Michael.
Thanks, Dana. I love the way you brought in the power and capture dynamics. And from my own home country in the UK, I think that was one where elite capture worsened during the pandemic for sure. Where I want just to give the panel a chance to come back with sort of, if there's one burning recommendation, like if they were sitting with, head of WHO, or, in Wangari's case, sitting with the president and thinking about one thing we should do differently that could improve governance outcomes for the next pandemic. Feel free to offer something, or also just a reaction to anything you've heard from the other panelists. And we'll just do a quick fire 1 minute each round and then wrap up the panel, because we do want to get into breakout discussions and also be respectful of the panelists' time. So I'm going to go slightly more random order. Zoya, if there's one thing you would really urge to policymakers, what would it be?
I would say you need to change your business intelligence processes, because if we have the effective business intelligence embedded in the national health system, it includes actually transparency and accountability. And by this, I mean traceable information, high quality information on procurements, on prices, on suppliers. I mean convenient channels for the civil society organizations and journalists to track this and to analyze and to give the feedback. This is my recipe. And maybe one more key thing is that all the manual data should remain in history, because it is useless, it is too slow, and it won't help you to make the grounded decisions and ensure value for money.
Perfect, thank you. So maybe Dana will mix up the order. Dana, I'll come back to you quickly, and then we'll go to Wangari after that.
Yeah, mine is short because I've kind of previewed it already. I would say it's health budget transparency with funding for movements and for civil society that can interpret that data, pressure government to be more accountable and responsive to your last citizen, to those who are historically excluded, and not just to urban elites.
Thanks, Dana. Maybe there's a project there for TAI and health funder collectives to come together and push that agenda. That sounds right. Wangari, what's your take?
Yeah, thanks, Michael. One, I'd like to just repeat or re-emphasize what Mariam said about scientific literacy. It is just so important, and not just around pandemics, but in health in general. How do you translate what you're hearing, whether it's being reported by the national organizations, the national agencies, or the international agencies? Scientific literacy is one area that has a true capacity gap. We must help those who are asking the questions understand what they're reading and ask the tough questions, just as Mariam said. Two very quickly would be to the international agencies. I think there's a level of understanding that I'm not sure has been previously communicated before, that the internet, a lot of low and middle income countries look to the international agency, not just for guidelines, but for guidance. And a lot of the time we interpret what comes out of the international agency as instruction, not guidelines. So if you say COVID prevalence or the numbers need to be below 5% before you can open up the economy, then we take it as instruction, and there's very little room, to contextualize. And if, for example, the government or whichever other agency is responsible takes a route that is different because you are applying whatever is local context, just I think as Nathan gave the example, I think Kenya did the same. In some regions, for example, Mombasa was harder hit by the pandemic earlier. Those kind of zoning of locking down. It also coincided with Ramadan, which and Mombasa is a heavily Islamic area, and so there was targeted social assistance for that time. But other countries were locking down the entire country. So when the national government decides to take a step or a direction that's differing from the guidelines, what comes back to us from the question askers, as Miriam put them, is negative. Is you're doing the wrong thing because so and so said. I will not name them because they're not present today. I like to name them when they're present. So and so said it must be this way. That's number 3. Number 4 would be to encourage other governments. Our government did it, and I think it was extremely successful. And I hope that we continue to use it, not just for pandemics. I think we've used it around childhood vaccines with varied success, but it's to use the mouthpieces that are trusted by the society. And for us, we had an interfaith council, which came in very, very strongly in helping us control pandemics in social occasions, whether it's church attendance, whether it's funeral attendance, whether it's weddings. The Interfaith Council came up with the protocols, which were an adaptation, whatever WHO has recommended and whatever the presidential committee and the technical committees had recommended. Very, very, very useful. It came from the bishops, it came from the imam, it came from the people who have power in those spaces, as opposed to a talking to. Thanks, Michael. I tried to speed talk there. I hope everything was captured. Sorry.
Very impressive. Thanks, Wangari, and all super relevant points. I love the round trusted intermediaries and voices and how to build around those. Nathan, what would be your top line recommendation?
Great, thanks. I'll see if I can sneak in 2 in just a minute. Number 1, channeling Dana a little bit and thinking about shifting power within the health system. There has been something of a revived movement recently to professionalize and really elevate the role of community health workers. And I think I would strongly endorse that as a recommendation to better prepare for pandemics, improving trust with communities, improving data collection where it needs to be collected, and also responses and tailoring of community needs. I think they have a big role to play. And then second thing is picking up on the importance of having an ability to stand up a coordinating mechanism for a particular response, but also leveraging existing institutions and processes that I touched on. I'm going to quote a couple of colleagues of mine, Ajwa Chum and Marian Opoku Ajiman, wrote a blog about this experience in Ghana that I'd highly recommend. And they end with this very interesting point that goes beyond just COVID or pandemic response, talking about the coordination that was set up. Several pressing issues, I'm quoting now, such as climate change, increased air pollution and urbanization, global aging, and digital technologies require collaborative, multi-sectoral, and multi-stakeholder action at different levels to mitigate their effects. Hopefully, COVID-19 has provided a template that countries can build on and apply broadly. I just thought that list of challenges was a fantastic one because they're all complex challenges that can come up quickly and urgently, sometimes longer term, and really require some kind of governance structure that can coordinate well at all levels. Thank you very much, everyone.
Thanks, Nathan. I can see we're definitely going to need to capture all of these insights and share them out. They deserve a bigger audience, and we can use the video today for that as well. But Mariam, final word to you.
Thank you. I think others have said the final and most important word, which is trust, contextualization, and then power dynamics. What I like to add to this is my highest on my wish list is a change from politically driven decisions. And we see a lot of politics driving decision, even strategic technical question, to data driven. And that means a lot of work for us right now to you build that literacy we talked about, but most importantly ensuring that data is at the fingertips of those who put pressure to power. Thank you.
Excellent. Well, we wanted to tap some of the insights of the rest of you on this call as well. I know there's a lot of experience and insight, so we're going to allow you to break out on some of the themes that you pre-indicated interest in, and Courtney's going to walk us into how that's going to happen, and we'll keep these pretty brief. And then, but it's good to hear from my side. I love hearing examples and viewpoints from more than our panel could do justice to in the time. So thanks to all the panelists. I hope that they will, if you have the time to stay in and be part of these 15-minute breakouts, that would be great as well. We're going to definitely finish promptly on the half-hour mark. Courtney, do you want to walk us through how this is going to work?
Sure. Thank you, Michael. And thanks to all of the panelists. This always happens at the end of a 90-minute session. We always lose people, especially in the interactive session. But thank you so much for those of you who can stay. Hopefully you can see this slide that kind of explains what we're going to be doing. Based on everyone's registration for the event, we've placed you into one of several thematic breakout groups. We'll open those up in just a minute. Those include breakout groups on strengthening resilient national health systems, ensuring supply of medical countermeasures and tools, and strengthening financing for pandemic preparedness and response. You should get directed directly into a breakout room, but if you don't, or if you want to change the topic that you're in, please just stay in the main room or come back to the main room, and our colleagues Jeanette and Leif can kind of redirect you. We'll have just about 15 minutes for this, so it's a short discussion, but we're really excited to hear from all of you. Finally, we have put some links to the Jamboards that we'll be using in the chat, but we'll also get a link to them when you go to your breakout, so don't worry if you can't get that. So I am going to open the rooms now, and hopefully we will see everyone in just a few minutes.